I was this close to graduating from university when my heart decided this is the perfect time to fail. Hi everyone, welcome to part 2 of my journey from heart failure to heart transplant. In this video I'll be talking about my heart failure symptoms, the difference between chronic and acute heart failure, and how my heart condition deteriorated so rapidly in the space of just 2 weeks and resulted in me being admitted into hospital. So as the years went on, the tests that I would have done showed my heart function was getting worse and worse over the years, but I didn't show any outward symptoms of heart failure. It was just the tests saying that, basically. And one of the things that kept coming up was this term known as ejection fraction, which you'd hear very commonly when you've got a heart condition because it's a way for them to measure how much blood your heart is able to release to the body as a measure of how well it's functioning. It's just a number, and for the large chunk of my life after I was diagnosed, my ejection fraction was less than 40, which kind of puts you categorically in the mild heart failure category, but I felt absolutely fine. And that's why heart failure is such a broad term, because you could have no symptoms of heart failure, like me, but your tests will be showing actually ejection fraction is less than 35, this test is showing that, you've got this, you've got that. But on the whole, you feel fine. But then on the other end of the spectrum, you could have people who are showing signs of heart failure, but then the tests don't confirm that. But the person is definitely showing symptoms of heart failure kind of thing. So, big spectrum. If we had to break down heart failure into 2 categories, for this particular video, I'm going to break it down into chronic heart failure and acute heart failure. Now, typically, when you hear the word heart failure, as horrible as the word itself is, you're probably thinking long-term condition. And you hear from the doctors that will say, we'll keep an eye on you, see how you're getting on with this medication, we'll keep monitoring your heart function, we'll see you back in a year's time. Things that imply that your condition is a long-term management. This is chronic heart failure, where symptoms gradually progress or require long-term management over months and years. But what we don't typically hear about is the other category of heart failure, which is acute heart failure. The main difference is that unlike chronic heart failure, where the symptoms can progress over months and years, very long term, the symptoms of acute heart failure can present within days to weeks. And it can be so severe that you often need to treat it like an emergency and you need to be hospitalised. So that's what I had. I had acute heart failure. And from what I understand, acute heart failure, you can develop it with no pre-existing heart condition, or you can develop it when you have a pre-existing heart condition and then all of a sudden your heart just drops in function, and so all of your organs are essentially starved of oxygen. Yay! Because I always assumed that heart failure was a chronic thing and it would progress over months and years, I always thought that at least it would give me some warning sign that my heart is getting worse. I never thought that what I was experiencing within that 2-week time period when I came home to revise for my exams, it never ever occurred to me that it was heart failure, because I'd never been educated about the fact that you can actually have acute heart failure, which presents itself in a very short time frame. So 1st of April, I'm all jolly, I'm playing my piano, calm, la-di-da-di-da, no breathlessness. 4th of April, I'm eating absolutely fine. I can eat a whole plate of food. By 6th of April, I noticed indents in my feet. Because I was just really cold, I'd be wearing 2 layers of socks. And at the end of the day, when I'd take the socks off, I'd notice an indent in my feet. 10th of April, I was reading my book in bed, and all of a sudden I noticed that I have to go and then I was like, that was weird. Why did I just have to do that? I had some mild pain in my chest and I thought, okay, let's just sleep it off. That was another sign that my heart failure was progressing. 11th of April, I started to get breathless just getting dressed. So I took a picture of myself and I said, I'm honestly hating the fact that I'm getting out of breath doing absolutely nothing. Is it anxiety or is my heart telling me to get active ASAP? I also started to notice that my weight was creeping up. I noticed that I was gaining weight because as I stood up in prayer, it was before you go Allahu Akbar and you start the prayer, but I just remember looking down and I could not see my feet. I couldn't see my feet. My tummy was in the way and my thighs were just massive. I didn't think too much of it, but then obviously I documented it on my Snapchat, kind of saying I'm getting fat. And you can see me in the video and I'm kind of just looking at my hands, and then I take a video of my whole body, and then you can see that this is very clearly fluid accumulation that has built up in a very short period of time. If you're gaining weight because you're not active as much, you're not just going to gain weight over a couple of days. It's going to be very gradual. This was very sudden weight gain, which was very clearly indicative of heart failure. By 13th of April, I did that thing because I was so desperate. I did that thing that a lot of people will probably do, and I googled my symptoms. Oh my goodness, please just don't Google your symptoms, because Google was saying I had lung cancer. Recently my lungs have been feeling it feels like there's a balloon here, and everything has been hurting. Feels like my lungs aren't reaching their capacity. I went for a walk after a long time, because obviously I was revising at home. I didn't make time for exercise. But then I think another reason I wasn't making time for exercise was because I genuinely didn't want to, and I didn't have the energy to. So 13th of April, I actually picked my bum up, and I'm not kidding when I say this walk was the most exhausting walk I have ever done. 10 steps out of my house and I was this close to turning back around and just crashing on the couch. But then I said to myself, no Marine, you're getting fat, you need to walk, otherwise you're just going to keep getting fat. Again, I didn't realise this is the heart failure getting worse rather than me just gaining weight because of not doing exercise. At least I know now. Also, throughout this time, my appetite was reducing. I was gagging a lot. The sight and smell of foods was making me gag. Even if it's something that I like, my first response would be to gag. 14th of April, I really started to feel unwell. Mind you, this has literally just been 2 weeks since I'm back home. I remember writing down, going to bed early tonight because I feel absolutely breathlessness is just way out of control and I'm absolutely shattered from doing absolutely nothing. Didn't do any dissertation work or any revision either today. After that walk, which was only to that grassy fieldy bit, I felt absolutely dead. Diarrhea, nausea, shortness of breath. Pretty sure my leg was swelling up in the shower because it had this weird indent in the skin, which seemingly disappeared later, but my chest has been feeling tight and stomach in pain for the past 2 days now. Today by far has been the worst, but I know the worst is yet to come. Am I dying? Wow. The next thing I say is, I blame stress. In the end, it's always stress. Ugh. Do you understand how frustrating it is to know that it was acute heart failure and here I am, like, blaming stress? It's frustrating, but that's why I'm trying to educate people who might be thinking the same as me at this time. Again, things just weren't getting any better. Literally within just 2 weeks of being home, I started with a plate full of food and it ended with me just having one single bite of toast. That's it. And I was full. And then I vomited. Vomiting every single day. The vomit was not stopping. Endless. By 16th of April, I had had everything. Diarrhea, nausea, vomiting, loss of appetite, really, really bad fatigue, chest pains, and really struggling to breathe at rest. I had had everything just crash upon me within those 2 weeks. By 16th of April, I remember this so vividly. I went into the kitchen. It was like close to midnight. I was leaning on the table thinking I just need to just hold it and catch my breath. And I was gripping my chest. My mum walked in and obviously she was really worried. And she said to me, "Maureen, just tell me, what should we do? Should I call the ambulance?" And I said, "No, we'll worry the neighbours." Yeah, I said that. Because I thought, look, if an ambulance comes, they're probably going to say, "Ugh, you've just been making a scene and if you contact us with no apparent reason." Because I always thought if you call an ambulance, like, you should be dying on the floor. And then I also thought that if the ambulance comes, like, all the neighbours are probably going to be on like hyper alert and they're just going to be so worried and contact us and they're scared and they're worried for us. That's why I didn't want that to happen. So my mum said, "Okay, you don't want to call the ambulance? Well, I'm going to tell your dad. I'm going to tell your dad what's been going on." So yeah, my mum called my dad. We had a video call and obviously he was out of the country. But as soon as he saw my symptoms and when I was describing everything, he just said, "You have to go to A&E right now. Not tomorrow, not in the morning, now." "17th of April, I had my first A&E admission. And I went to this A&E in the middle of the night with my mum. The reason why this A&E experience wasn't very good was short and sweet. The doctor it's like he was just ignoring everything I was saying. So I was explaining to this guy, like, exactly word for word what I felt was important. And in the end, I remember asking him, I was like, "So is my heart okay?" He's like, "Yep, looks fine." Bearing in mind, what was he going off by that? ECG and just a chest x-ray. That's it. No echocardiogram, no pro-BNP blood test, which is a very simple and cost-effective blood test to measure heart failure. Yeah, he didn't do any of that. And this A&E doctor was basically saying, because you've had a lot of increased shortness of breath, we did a chest x-ray to see your lungs and we've seen a small shadow, and so we're going to give you antibiotics and send you home. The shadow in my lungs that they were seeing on the chest x-ray was in fact fluid buildup as a result of my acute heart failure episode. And I've heard from other patients this is actually quite common, to have your heart failure misdiagnosed for a chest infection. But I think that's more common when you don't have any pre-existing heart conditions. I'm here with a heart condition. I've had it for 7 years and I'm going to this A&E
with symptoms of heart failure.
And he's like, "Oh, yeah, it's just a chest infection." Very next day, obviously, because I did not have a chest infection, my condition got even worse. My dad got the first flight back home. He took me to another A&E and they said, yeah, your heart is actually doing really bad. You've got heart failure. Your heart is working at 25%. That's what they found from the echo. It was 25%. So this second A&E, they started me on furosemide, which is basically a medication that helps you release loads and loads of fluid, especially if you've got fluid building up in your body. They're probably going to give you furosemide or something similar just to try and get that fluid off of your body and to help the heart function a little bit better. But after 2 more days, I still wasn't doing good. Because at that point, I guess what happened was the fluid had built up so much, tablets weren't gonna help release all of the fluid. By 20th of April, I was admitted into hospital because my heart failure had progressed so rapidly. I couldn't walk, I couldn't eat, I couldn't sleep, I couldn't breathe. Just before I was admitted into Leeds, I was so short of breath. I'm looking at the bed right now, by the way. I was here. And it was the middle of the night. My pillows were literally stacked up and I could not sleep because I was so out of breath. So I sat up on the bed thinking maybe it would help just clear the airways, but that's the thing. It's not an airway issue. So I sat up on the bed, I sort of went, nothing, didn't help. Then I stood up thinking maybe I need to just stretch my body, maybe by standing it will help. It didn't help. And then I took a few steps until I was just shattered. And I just crashed back on the bed. And I just said to myself, Marion, just pray that you'll see the next day. Because I had no guarantee that I had no idea if I was gonna wake up the next day. Anyway. In the next video, I'll be talking about my time in the hospital and just how poorly they found out my heart was. Yeah. I hope this video has helped. Again, I just want to point out this was just my perspective on heart failure, but I hope you know the difference between chronic and acute heart failure now, and I hope more people are aware that you can have heart failure symptoms within days and weeks, like I did. Take home messages. Not everything is due to stress and a lack of exercise. If you have something that seems to be getting worse, whether it's symptoms, anything, you need to go and seek help. Do not ask Google because Google does not know your medical history. And also, if you need to call an ambulance, call an ambulance. Don't hesitate. Help will always be given to those who ask for it. You've just got to ask for it. Thank you for listening, and I hope this has helped.